guys, we're going to talk tonight about the mnemonics. You guys have been studying your mnemonics. You did your homework, you read your chapter, so we know about the mnemonics. Now we're going to work on how do we put those mnemonics into our patient assessment. Have a little handout for you here. You want to just pass those around? Curtis is here. He's going to help us with our patient assessment. Michael's going to be our patient. So, first thing I want to do, Curtis, your call, your dispatch to a 62-year-old male complaining of chest pain, private residence.
Arrive on scene and put my body substance isolation on.
Okay.
Does my scene look safe?
Your scene is safe.
Okay. So I enter the residence. What's my general impression of the patient?
Okay, you see your 60-some-year-old male seated in a chair watching TV.
So I have no signs of obvious bleeding or severe distress?
None.
Do I see any other patients?
You do not. One patient only.
I need no other resources.
No
at this
other
time.
resources. Okay, hold up right there. At this point in his assessment, what does he need to do now? He's done his scene size up, he knows it's safe, he has one patient, he doesn't need additional help, and he has his body substance isolation on. What mnemonic does he need to use now?
MOI.
MOI, NOI.
Yeah.
And MOI, Denise, stands for what?
Mechanism of injury.
And that would relate if this were trauma, right?
Correct.
So we don't use the MOI, we use NOI. Curtis, what is NOI?
Nature of illness.
Okay, so we want to see where is this illness coming from? Where's this chest pain coming from, right? Go ahead.
Hi, sir. My name's Curtis. I'm a paramedic. What seems to be going on tonight? Your chest hurts.
Okay, so he's interacting with him, finding out about his chest pain, right? So he kind of has that chief complaint, so it's going his way so far. What's the next thing that he needs to assess on this patient? And what mnemonic does he need to use to do that? Okay, Joanne, tell me about AVPU. What is the A?
Alert.
Okay, so he's just alert, he's sitting there looking at us, right? Yesenia, how about the V?
Verbal.
And verbal means what?
Talking.
Speaking and he is.
Okay, so if he were sitting there with his eyes closed and Curtis were to speak to him and then he were to react to that, that would be a verbal response, right? What about the P?
Pain.
Pain. So if he's not looking at you, if he speaks to him and he still doesn't respond, then he might do what? Maybe pinch him, do a sternal rub. If he gets a reaction, then he is alert to a painful response, right?
Yes.
And if none of that works, the U comes into play. What's the U, Jennifer? Dixon? Joanne?
Unresponsive.
Unresponsive. He's not responding to anything, right?
Right.
Okay, go ahead.
So I've determined my patient is alert. So now I'm going to assess CABCs.
Okay, and
So he has-
CABCs, hold on. What are CABCs?
Circulation, breathing, and circulation.
Okay, so circulation, he asked about major bleeding, there's none, right?
Yes.
Airway, what does he want to do with airway?
Open.
He wants to make sure that that airway is open and that his patient can maintain his own airway, right? Because if not, then he's going to have to do something about that, okay? What about the B?
Breathing.
Breathing.
Denise, what about breathing? What does he want to know?
Rate, rhythm, quality.
Because he wants to make sure that that breathing is adequate, right? Okay. So once he gets the adequate breathing, then he moves into the C, and where's that? Circulation, and what does that mean?
Pulse and blood pressure.
He wants to make sure that he has adequate circulation. And we've talked about all those things before, that make sure that you have adequate breathing, adequate circulation, right? Go ahead, Curtis.
So I'm going to check my respirations and a pulse.
Okay, he is breathing
Rate rhythm quality.
about 20, 22 times a minute, regular,
Okay.
non-labored,
And pulses are.
and his pulse is strong, regular, and about 90 times a minute.
Okay.
Okay, hold up right there. All right, now he's got this. He knows that his patient is alert. He's got an adequate airway breathing and circulation. Now he needs to focus on what? That chief complaint, right? How's he going to focus on the chief complaint? There's a mnemonic that he can use. What would it be?
OKURST.
Good. So somebody tell him what's the O.
Onset.
And what does he need to ask him?
When did it start?
When and how did it begin? How about the P?
Provocation.
Provocation?
And what is provocation?
Right on.
What provocated, what initiated it?
Okay, what, does anything make it come on or make it worse? A provocation is what starts it or makes it worse, and what's the other word?
Quality.
Palliation, what makes it better or makes it go away, right? Q,
Quality.
and how am I gonna ask him about quality? Sir, what's the quality of your pain? Not so much, right?
How
What
does
am I
it
gonna-
feel like?
What does it feel like? What does it feel like? And the R,
Radiation.
Radiation,
go
is it
anywhere.
going anywhere?
does it go anywhere? And if it does, with one finger, show me where it goes, right? And how about the S?
Severity.
And how will I ask him about severity?
On a scale of 1 to 10. Time.
Okay, scale of 1 to 10 for severity, and T.
Timing.
And what is timing?
It's constant or if it's intermediate.
Okay, go ahead.
Should we go through those first?
Yes, please.
Sir, when did this start for you?
A few minutes ago,
A few minutes ago? What were you doing when it started?
just watching TV.
Does anything make it better or worse?
Actually,
If I were to recreate that pain on me, how would I do that?
it's like how that's sitting.
All of this in your chest. Does it go anywhere in your chest? Go to your shoulder, your arm? I would know your arm. On a scale of 1 to 10, how would you rate this pain? 10 being the worst pain you've ever had in your life.
No,
Does this pain come and go, or is it constant?
constant.
Okay, hold it right there. So now we're kind of getting an idea of what's going on with the patient. We've got his signs, some of the things that are going on with him, how the pain started, how bad it is, what the timing is. What's another mnemonic that's going to help us look at this patient?
Sample.
Sample. What does the sample tell us? Signs and symptoms. What are his signs and symptoms?
Chest pain.
Chest pain. And it happens to be radiating chest pain, right? What is the A?
Allergies.
Allergies.
Allergies. What do I want to know, Dixon?
If he's allergic to any kind of food, medications,
Okay, any allergies that he might have, right?
yes.
Curtis, tell me about the M.
M is if he's taking any medications.
Okay, so you want to know what medications might he be taking? Do I want to only know prescription medications?
over the counter.
I want to know any medication that he's taking, right?
Herbals
Okay.
or
How about the P? Denise, P.
Past medical history.
Okay, how am I going to ask him about past medical history? Just ask him, sir, do you have any past medical history?
Have you had any surgeries? Have you had this before?
I want to be kind of specific, because if you just ask them past medical history, they may just look at you like, huh? Maybe ask them, do they have any medical problems? Have you ever had surgery? Have you, any ongoing medical issues? Okay? And L? Yes, any?
Last
L.
intake.
Okay, and what do I want to know there?
Whether he has eaten anything, whether he has taken anything that may have caused a problem.
Okay, so last oral intake, what did he eat? What did he drink? Did he take any medication? That kind of thing. And the E.
Events leading to the present illness.
And how will I ask him that, sir? What were the events leading to this problem?
What he was doing when
What were you doing when it began? Very good. Why would that be important, do you think?
Because it will help you to determine, whether he was either exercising or whether he fall or what he was doing that must have caused
It might give us an idea of what caused it. You want to go ahead and go through that sample for us?
So I know my signs and symptoms.
Okay.
So, sir, are you allergic to any medications or environmental?
Yes, sir.
Do you take any current medications?
Yes, sir.
Do you have any medical problems? Have you ever been hospitalized for anything before?
Yes, sir.
No surgeries or anything?
No.
When was the last time you had something to eat?
Around 8 o'clock.
Anything unusual that you ate, or is it something you normally eat?
Something I normally do.
And you said before this you were just sitting here watching TV and pain started in your chest.
Yes, sir.
Okay, very good. All right, now what I want us to do, we're going to break into small groups. You have, each of you will have an instructor, like 3 or 4 of you with an instructor, and I want you guys to do exactly what Curtis has showed you how to do. Can we do that?
Yes.
Ma'am.
Awesome, thank you.
Thank you.
Cool.